computer. We are now live on Facebook. It is setting it up. And I am going to broadcast. Are you ready?
Ready.
Here we go. Good morning, everyone. Thank you for joining us today for our presentation on cancer symptoms women shouldn't ignore. We are joined today by Sylvia Brown. She is a nurse navigator in the cancer prevention at the University of Texas MD Anderson Cancer Center. She helps deliver cancer prevention presentations in the greater Houston area. She has graduated from the University of Texas Health Science Center at Houston with a degree in nursing and a master's degree in nursing from Texas Women's University. Ms. Brown, the floor is yours. Thank you for having us today.
All right, thank you for having me. Appreciate it. Excited to be here. So we're going to talk about cancer symptoms women shouldn't ignore today. Just before we get started, I want to let you know I'm presenting from home. So that's something that, the new normal now. So I'm protected. I don't have to worry about social distancing, but sometimes we prevent from MD Anderson. I just wanted everybody to know that we're very careful at MD Anderson. Everyone wears masks when they're patients, staff, caregivers. So we make sure that we protect all of our patients and everyone that comes into the institution. This should be interactive. If you have questions, you can type them in on Zoom, or also you can stream them, through live. Matthew and Laura will be helping fill those questions. So please feel free to ask. I'd be happy to answer them for you. And if we don't have the answer for you today, we will get them to you. We'll get them to Matthew and you can pass that on. So without further ado, we'll go ahead and get started. So cancer symptoms women shouldn't ignore. This is a very important topic and I'm excited to share some of this information with you today. All right, so we can't have this presentation without talking a little bit about COVID. So we definitely want to help stop the spread. I know recently that the cases have been increasing. So it's really important to continue to be diligent and stay 6 feet apart. Social distance, wash your hands. Washing your hands for 20 seconds with soap and water, rinsing well, very important. And then wearing a mask when you're out in the public or around others. And then if you do feel like you have symptoms or you're not feeling well, get tested. You'll have to isolate if you do have it, obviously, but it's better to know. And we do want to make sure that our patients at MD Anderson are safe and do recommend testing if you're symptomatic. All right, so let's get into the meat of this presentation. Breast cancer is the most common cancer in women. It is the most commonly diagnosed and it's the #2 cause of death. So about 266,000 new cases occur in women each year. So it's about 1/3 of all cancers. So this is something that I know that we've heard a lot about, that we need to continue to spread the word and educate women on signs and symptoms and making sure everybody is aware. And that's what we're going to do today. We're also going to talk about the female reproductive system and the types of cancers that may occur in this area. So this is just a little anatomy lesson. It's just showing you the ovaries, the uterus, which is what sheds the lining every month and also houses the fetus whenever a woman is pregnant. Then that is connected to the cervix and also connected to the vagina. So we're going to talk about these types of cancers today, signs and symptoms that you should be aware of, and when to seek medical care. All right, so if you are on Zoom, click your button if you think endometrial cancer is the most frequently diagnosed cancer of the female reproductive system. Give you just a little second to touch your button. The answer is true. Endometrial cancer is the most common cancer of the female reproductive system. It's the 4th of all female cancers and is the 6th most deadly cancer in women. And we'll talk a little bit more throughout the presentation about those signs and symptoms that you really need to be aware of so that we can catch this early. So ovarian cancer is most often diagnosed at an advanced stage. Why is this? Because a lot of times the women ignore the signs and symptoms that are present or mistake them for something else and don't seek medical care until it's very advanced. 4 out of 5 patients are actually diagnosed at an advanced stage. So really important, and I hope we can educate you guys today to help you be aware of what you need to look for. Cervical cancer rates are on the decline, and this is a good thing. And this is because of our pap test that we get and that is recommended for women. And we're detecting it early. So this is what we want to see. And also more women are getting the HPV vaccine. It's been around for a while, and we're seeing a decrease in cervical cancer cases. So this is all great news, and we need to continue this as we grow up and we have daughters, and we need to educate the younger population and make sure they're aware. And we are seeing the benefits of this HPV vaccine. So approximately 110,000 women will be diagnosed with a reproductive type of cancer. That only accounts for 15% of the cancers. So it's really important to know it's a small percentage. They're not as common, but it's really important to know the warning signs for these diseases. And some of the warning signs that we'll talk about today might not necessarily mean that you have cancer, but it might be warning signs of something else. So the key is that we can take action to reduce our risk, and this is what's important. So recognizing those warning signs, taking action. There are things that we can do that we're going to talk about today that we can reduce our risk of getting these types of cancer. So that's also important. So let's get into that. Let's talk about the warning signs and the symptoms that are important to know. So if you're having one or more of the following symptoms we're going to discuss for 2 or more weeks, it may not necessarily be a sign of cancer, but like I already mentioned, it could be a sign of another problem, and it needs to be taken care of, and you need to seek medical care. So one of those signs and symptoms is irregular bleeding. More than 90% of women who are diagnosed with uterine cancer experience irregular bleeding. If you have already gone through menopause and have any type of irregular bleeding, that is not normal. You need to seek medical care. I know that a lot of times our patients will have a certain symptom and just think I'm going to ignore it for a while. That is not recommended. It is better to go and seek medical care and find out that it's nothing or something that really can be taken care of rather than be something more serious. So very important. If you haven't gone through menopause and you're having irregular bleeding through between periods or have heavy, very crampy, these are all things that you need to just seek medical care for. It may be nothing, but like I said, it's better to find out it's nothing than to have it be something serious. So please just recognize these types of signs and symptoms. You know, these can be signs of cervical or vaginal cancers, something we probably don't think about as often, but it does occur. So important, again, to get this checked out and speak to your physician about these warning signs.
Sylvia, a quick question from the audience. Can you
Yes.
define irregular bleeding?
So most women are, let's just say, a 28-day cycle. If you have something that is irregular, meaning not your normal, so we're all different. So if you're irregular every 28 days and then all of a sudden you have bleeding at 14 days, that is irregular. If you are post-menopause and you are bleeding, that is irregular. Any spotting, bleeding after sexual intercourse, anything that is not the normal for you is irregular. And that's really important to know our bodies. What is normal? What is regular for us? Any change, and that goes for all of our systems. That goes for, we're going to talk more about this, but that goes for bowel habits. That goes for different things with our breasts. That goes for we're not feeling right in our abdomen. All of those things that are different, that persist for more than 2 weeks, we need to seek medical care, and we often ignore those signs and symptoms. And then women come in with advanced cancers whenever, you know, probably could have caught something early. And I'll talk more about that throughout the presentation. Thank you, Matthew, for asking that question. And feel free to ask questions throughout the presentation, and I'll answer them as best I can through the presentation. Thank you. So unexplained weight loss. We all want to lose weight. If you are exercising, you're eating healthy, you're active, and you're losing weight, that is great. But if you are going about your normal routine and all of a sudden you've lost 10 pounds, that is unintentional. That is not okay. If you are eating more and still losing weight, then you need to seek medical care. Cancer is aggressive. It boosts our metabolism. It takes a lot of energies for these cells to divide so rapidly. So it is very, very important for you to be aware. You might think, oh, this is great, I just lost 10 pounds. But again, if you're not exercising, you're not dieting, you're not trying to lose weight, and you just lose 10 pounds, that is a reason to be concerned and a reason to seek medical care. Fatigue, constant fatigue. So I'm not talking about, as women, we're active, we're busy, we're taking care of our kids, so we're tired at night. But I'm talking about the type of fatigue that no matter how much rest you get, no matter how much sleep that you are getting, you are just exhausted in the morning. It is affecting your activities of daily living. It is affecting your home life, your job. Severe fatigue, that is something you need to seek medical care for as well. So you're just exhausted and just feel like you can't get out of bed and function on a daily basis, seek medical care. That is definitely one of the signs and symptoms. Appetite changes, another important aspect. If you're feeling full all the time, so you're just really never hungry, but you're feeling full, just that sense of fullness, that can be a sign of ovarian or other type of cancers, also some gastrointestinal. So be aware of that. You may think, oh, this is great, I'm not hungry, I can eat less, but a change, that goes back to what I said earlier about a change in your diet, a change in anything within your body that you have not intentionally made, you need to seek care for that. Pain and discomfort. This is something I think a lot of us ignore. Oh, that's just a little pain here and there. But it could signal and be a sign of some type of cancer. It could be gynecologic, or it could be gastrointestinal. So some discomfort, just feeling full, like I mentioned, having gas and bloating. And I'm talking, this is constant over weeks. Indigestion, pressure, bloating, cramps. They could all be signs of some type of gynecologic cancer, specifically ovarian. So if you have that persistent indigestion or nausea, that also can be signs of some type of gynecological cancer. So again, be aware of your body. Now, having a little bit of nausea and not feeling well for 24 hours, that's, probably a virus. But something that's persistent is really key, that you're just feeling this for several weeks over time. Definitely want to discuss that with your physician. Really important to just take note of those changes, because I know for me, I'll go into the doctor's office and kind of forget some things to talk about. Oh, I wanted to talk about that. Luckily now we have these wonderful MyChart systems and you can send messages, but just be aware of your body. It's really important to be in tune, not to be fearful for every, ache and pain, but just to be aware of changes is really important. It'll be helpful to your medical physician. Yes, Matthew.
Another question. Is there a difference in symptoms between non-cancerous ovarian cysts and ovarian cancer?
Well, they can be similar and they can be the same, actually. So that's why it's important. If you have ovarian cysts, but you're having these persistent symptoms that I'm talking about, it's a good idea to go in and get those looked at. Because again, it is, much better and beneficial if you go into your physician, you say, I'm having these symptoms, they are worrying me, and they do an ultrasound, they found out you just have a cyst. Wonderful. That is great news, but at least you've checked it out. It's so much better to do that than to wait and then to go in and have a full diagnostic workup and then find out that you have advanced type of ovarian cancer or uterine cancer or cervical cancer. So really important just to be aware, like I said, and talk to your physician. They will help you sort through those thoughts and concerns and let you know what needs to be diagnosed or worked up further and what's okay. So I would always recommend seeking medical care and suggestions for those types of things. Changes in bathroom habits. This is important too. So if you're feeling constant pressure in the bladder area, just again, that fullness, maybe some pain, but just that feeling of full that you constantly have to go to the bathroom, you just went to the bathroom, but now you feel like you still have to go. That's also a warning sign to be aware of. Also, changes in your bowel habits are important to be aware of. If you're having severe constipation or you're having a lot of diarrhea, those are things that you need to seek medical attention and care for. Now, if you're drinking a lot of water, let's say you're starting to work out more and you're drinking more water, or you just know that increasing your water intake is beneficial and you're urinating more, that's different. Or if you're pregnant, a lot of times, of course, you're going to increase your trips to the bathroom. That's different. That's intentional. But I'm talking about more of things that is unintentional. You really haven't changed much, but now you're noticing the change in the trips to the bathroom. Again, fulling, burning upon urination, all of those things are regular, and you need to be aware and seek some care for that. So a breast lump. A breast lump is never normal. Any type of lump should be investigated, should be assessed, and should be looked at. It could be a cyst. This is my area of expertise. I work in the undiagnosed breast clinic at MD Anderson, and I'll talk a little bit more about that towards the end of the presentation. But anything that changes within the breast is not actually normal. Now, you may go to the doctor and they may say it's nothing. Great. You may have cyst. A lot of women have cyst in their breast. Great. But at least you've checked it out and you have ruled out any type of breast cancer. So it's really important that you're very familiar with your body, know what your breasts look like, be able to recognize any type of lump or thickening, a hard knot or swelling. Also in the armpit, so up to the collarbone, all of the chest area and under the armpit. It's really important to check that area. That's all part of the breast tissue and important to be aware and to check that out as well. So if you're on Zoom, you can click your button if you think a breast lump is the only warning sign of breast cancer. The answer is false. There are many different signs and breast changes with breast cancer. So again, important to be aware. It's not just a lump that signals breast cancer. There are different types of cancer. So inflammatory breast cancer may appear as a rash all over the breast. So any redness or rash appearing on the breast should be investigated. Of course, a lump, if you find a lump. Also swelling, so enlargement of breast, not necessarily a single lump, but swelling is important to be aware of. And then under the armpit, as I had mentioned, and then an orange peel texture. So just looking like an orange. And if you've ever seen a picture, then that's what it looks like. It's just this tiny dimpling in the breast. And then an indentation on the breast. So not necessarily the orange peel, tiny look, dimpling look. It might be a larger dimpling in the breast. So again, any changes, it's important to be aware and have breast awareness so that you can identify these types of changes. Very important. So nipple changes, this is important too. Sometimes ladies will call us and say, you know, it's inverted. You know, my nipple is completely pulling in and inverted. Nipple discharge is not normal. Now, if you are pregnant or if you have been nursing and you're weaning off, of course, you're going to have that. But it's better to be checked out. They can run diagnostic tests on that just to make sure that there's nothing going on. So if there's any nipple discharge, and we see women every day with this, it's important to have it looked at. A change in a direction of the nipple, an ulceration. You may think, oh, I just have a little sore here, it's going to heal. That is something that you should have looked at. If it persists for more than 2 weeks, seek medical care. And then maybe you're seeing just a scaliness or a rough patch on the breast or the nipple. This is important to have looked at it as well. Again, it's not just a lump in the breast that indicates breast cancer. There are different types of breast cancer and important to seek care for those changes. So there are things that we can do to take action, and I'm going to share those with you right now. So mammogram, I love this cupcake. That's so funny. So at age 40, yes, you should, the recommendation is that you should start getting a mammogram at age 40. However, if you have a strong family history, then you might want to talk to your medical professional about starting that earlier. And is also recommended at ages 25 to 39 that you get a clinical breast exam. So have your physician do a breast exam to have, you know, the full workup. If you have a family history of breast cancer, we know that it accounts for about 5 to 10%. However, you want to make sure that you're telling your physician because maybe you need more frequent screening. So it's important to know that, and it's important for you to tell your physician. So just in case you need that extra screening time, we have ladies that come in every 6 months for screening. So if you qualify for that, you would want to make sure that you get the screening more frequently. So getting a PAP and HPV test, this is very important. I'm so happy that we have this now. As I had mentioned before, the cervical cancer rates are declining, and it's because of this. So the recommendation is getting a PAP every ages 21 to 29 every 3 years. Ages 30 to 64, they recommend a PAP with the HPV test every 5 years, or every 3 years without the HPV vaccine. I know some physicians still like to do this yearly. Just talk to your physician to determine that, but this is the recommendation. If you've had a hysterectomy and you still have your cervix, you need to continue to get the PAP test. And then if you've had a full hysterectomy without a cervix, talk to your physician to find out what type of screenings that you would need. So click your button if you think all women should get tests for uterine and ovarian cancer. So this is specific test for uterine and ovarian cancers. The answer is no. So only women that are at high risk should have that type of screening. So women who have Lynch syndrome would probably want to get the CA-125 ovarian cancer testing, and then maybe have screenings every 6 to 12 months. And also those patients with BRCA positive, so BRCA positive 1 or 2, you will definitely need more frequent screenings. You would want to get that CA-125 test, and also that goes for breast screenings. You would want to talk to your physician and get more information about that. So super important to get the HPV vaccine. This came out years ago, and as we have been mentioning already, the benefit that it's really decreasing the number of infections. So 80%, approximately 80% of men and women will be infected with the HPV virus. So again, very important to get that screening. We can help protect our children. So the recommendation is age 11 to 12 and being completed by age 13. So that is for immunity, so that they can get the maximum benefit of the vaccine. Maintaining a healthy weight, very important. The recommendation is 150 minutes of exercise, of moderate exercise a week. So that is walking, that is yoga, exercises you can do. You can still talk, but you couldn't sing. Vigorous exercises is recommendation for 75 minutes per week, and that would be running, biking, those types of vigorous exercises, and you would not be able to talk at all. This is really important because being overweight actually leads to certain types of cancers, specifically breast, ovarian, and uterine. So important to maintain a healthy weight. Staying active. So sit less. I know a lot of us have desk jobs, including myself. So I try to get up every hour, and it's hard to do because you're really busy, but I just try to, if I go get a drink of water or something like that, to get up and to move. So really important to not just sit for extended periods of time. Also important is weight training. Building muscle helps build bone, which as we age, we lose. So, and how the benefit of building more muscle is sitting at your desk and burning calories. So twice a week is the recommendation. If you do that more, great. This has always been a struggle for me, but I really try to at least get in those 2 times a week. So limit your alcohol. So even a small amount of alcohol increases our chances of cancer. So if you are going to drink, you should limit yourself to 1 per day. That means 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of liquor. So that's something important to be aware of. Avoid tobacco and vaping. I know we've heard a lot about this, but yes, smoking does lead to lung cancer, but it also leads to other types of cancer. Could increase your risk of cervical cancer as well. So the benefits of quitting, they start as few as 20 minutes after your last cigarette. And I think a lot of people don't know that. However, now a lot of teens and others are going to the vaping, which is also not safe. It actually contains a lot of nicotine, not to mention other chemicals, and they're making it very appealing to our teens with the flavors and those types of things. But it's really important to educate and participate in smoking cessation. Know your family history. This is also very important. If you can, gather that information, because certain risk, obviously, certain familial risk are there. I know in our clinic, we screen every patient for their family history, and it helps us determine how often do we need to do screenings. So important to know, talk to your family members if you can, and get your family history. You might need a genetic counselor. You may need to do some genetic testing, and that can all be determined by your family history. That's our presentation for today. We have gone over all of the risk of the female types of cancers, and we are here to help at MD Anderson. Our Cancer Prevention Center does all types of screenings. We do the breast screenings, gynecologic, colon, many types of screenings. So we are here, and as I mentioned before, we are protecting you. I know a lot of patients have told me, I'm afraid to come in because of COVID. We are protecting our patients. We are taking temperatures. Everybody's wearing masks. We are screening at the doors. We are also limiting the number of patients in one area. So spacing out our appointments to make sure that you all are safe. We do, for the breast screenings, you can schedule yourself online for the breast screening. And then if you are having any of those breast symptoms that I mentioned today, we have an undiagnosed breast clinic, and that's where I spend most of my time in cancer prevention. And so if it's a breast lump or nipple discharge or a rash or something you're just not sure of, we can take care of you in the undiagnosed breast clinic. It's a really comprehensive clinic where you can have your diagnostic imaging and get same-day results, and you'll meet with one of our expert providers. So just wanted to mention that, as well as we have gynecologic screenings. All of that can be found on our website and also online. And Matthew, I'm happy to share my email address with you. Sure. And if they have additional questions or think of something after this presentation, I would be happy to answer that for you.
That would be great. I think everybody's asked their questions, but if you're okay with it, I'll share your email contact with all the
Sure.
Attendees.
Absolutely.
And they can contact you directly if they have any further questions. Just wanted to say thank you for your time today. It's greatly appreciated. This content is very, very important, not just to the business community, but our community as a whole, and everybody that's inside of it. So we appreciate your partnership, and we look forward to more programs.
Thank you so much. Thanks for having me today.
Thank you. Have a great day.
Have a good day.